Good day and welcome to New World, folks. This is Dr. Uzoma Mobani coming to you with our FICAP scrolls. Today we're going to be talking about the management of pelvic organ prolapse. If you're listening to this, most likely you would have listened to my maiden talk on POP, and you might be getting a grasp on exactly what pelvic organ prolapse is. To recap, it is the descensus, the hernia of all or parts of the pelvic organs through the vagina heading out. So should you be experiencing that and you are here in clinic with those symptoms and concerns, I'm going to be discussing with you what we will be doing with you to help you get back in top form and shape. I will be taking your history while you're here, and I will be examining you and staging your prolapse. Prolapse, in a common staging method that is well understood by the lay person, can be divided into 4 stages depending on where they are in the vaginal canal or if they are now heading outside already. Here in gynecology, we are really concerned mostly with stage 3 and 4 prolapse. That tells you we have stage 1, 2, 3, and 4. Stage 3 and 4 prolapse is when the patient actually is able to notice that she is experiencing some descensus, and that is also when some of the problems associated with prolapse tend to occur. And with that, I'm talking about increasing pelvic pressure as well as urinary symptoms that may also come with a cystocele, which is a prolapsed bladder. So I will stage your prolapse and let you know where you are in that totem pole, and then we will plan to do some testings for you. Our testings actually geared towards finding out if there are any other reasons than meet the eye while your organs are trying to run away from your body. We're also going to try to figure out if there is any other associated abnormalities with the prolapse. Should you come with a bladder prolapse, we will do a bladder workup for you to also make sure that we can elucidate if you have any potential incontinence problems or problems that will come after we have done your surgery. If it's the uterus coming down, we will make sure you're up to date with your PAP, and we'll do a pelvic ultrasound to check out your ovaries. Should you need to have a hysterectomy, we'll need to make sure whether the ovaries need to come out or not. If you're having fecal incontinence with your rectocele, you may need to have an anal ultrasound plus or minus an anal manometry to decipher what's happening to your anal sphincteric mechanism and group. So once that is all done, I will sit down with you and discuss the results of your testings and let you know what your personalized plan of management would be. If that plan would include surgery to get things back in anatomical shape again and give you back your vagina, we will discuss all the options you have for surgery. Talking about surgery, most of our prolapse surgeries are done via the vagina, which is the least intrusive to your body, the route that is least intrusive. Should you be a good candidate for a vaginal prolapse repair, we will discuss what exactly we'll need to do and whether we'll need to give you a functional walk-in vagina, or if you are old enough and ready for it in all ramification, probably even close your vagina, what we refer to as colpoclesis. So in my next video scroll, we'll be discussing how you're going to prepare for your surgery. When it comes to surgery for prolapse, we do it through the vagina, and this day and age is actually done as a day case, including hysterectomies if you will need it. And when we do it through the vagina, we can give you a walk-in, straightened, properly anatomically aligned vagina with an elevated bladder and rectum. Or if you are the proper candidate for it, perchance you've had this problem more than once before, or you're old enough and sex is no longer paramount to you, we can actually do all the elevations and suspensions and close your vagina. Closing your vagina accords you a definitive, sure treatment to know that you will never have recurrence of your prolapse again. If we don't close your vagina, we'll try our utmost best to refashion and to reconstruct your vagina to be working enough, but still give you the least probability of having that prolapse recur again. And what I also do for everybody is, remember I mentioned pelvic muscle wasting. We also take care of your guys well when we do our prolapse surgeries. We try to bring back that levator anal muscles together so you can have have a good introitus and have a good grip on the penis should you be sexually active again. The guys will love that too. So with my next teaching, we'll talk about how to prepare for your surgery. There are some other non-surgical methods for treating prolapse, but they really don't treat the prolapse, they just like band-aids to it. If you're a candidate, we'll let you know after we've discussed the pros and cons to it. So in my next video, we'll be talking about how to prepare for your surgery. Now you have a better understanding of how a prolapse is all about and what we need to do to get you from where you are now to a point of wholesomeness. Thank you for listening, and bye-bye, and I'll see you at our next video. Bye.